Okay, so here is your in-service on a vaginal table. I have one sterile hand so I can show you. This is a sterile table. I'm going to pass by slowly so you can see. This is for a vaginal delivery. Usually you're going to open up two things. You're going to open up your pack, which is this part, onto the back table. And then you're going to open up a separate pack that brings this metal tray with these instruments on it. Depending on your hospital, my hospital made a rule that now we have to use mini laps for the vagina to prevent any small sponges from staying in. Of course, this freaking paper wants to stick. So you're going to open up two things. And I like to lay the laps out one by one so the nurse can count it. Because you have to count before and after. Usually the tech and the nurse will do it, the doctor won't even do it. You got your bulb syringe, you got this in case you have to give lidocaine, in case he has to do an episiotomy, which will be either midline or right medial lateral in case the baby needs more space to come out. This big needle, which is in 18 gauge, will be to draw up the lidocaine. Then he'll switch to this one, which is like a 25 gauge or 22 gauge, to inject the patient with it. Again, you have your cord, baby cord blood collection with the top right there. You have a cord clamp for the baby. Do not ever close this because it'll lock. It'll lock into place, so leave it open. Don't ever close it. Your forceps, your straight mayos, your bandage scissors, your Kellys, hemostats, needle drivers, Alice, and sponge sticks. In this pack, you'll get this drape, which is a half sheet. You have the doctor's gown, and then you have this drape that goes under the patient's butt, and it has a bag to collect all the blood and the nasty stuff. This pitcher comes with the instruments. It's mainly to use with soap at the end to clean up the patient. And this bucket, never throw it away because usually they'll put the placenta in here. So that's pretty much it. So now with this half sheet, I'm going to cover up this whole table. And depending on your hospital's policy, we'll keep it up to 24 hours. And we cover up this whole tray, this whole table. And what we do then is on top of it, see now it's covered for whenever we have a delivery. We're going to put betadine as long as the patient's not allergic. And we're going to put a 4x4 for the prep and a size 8 gloves. Most of the doctors wear size 8 in case of an emergency. We're ready to go for a delivery.